All right, listener, get ready, because we're diving deep into something you're clearly fascinated by, eyes and vision.
Yeah, we got your request.
We checked out those articles on eye health you sent over, and wow, color us intrigued.
Definitely.
Seems like you're really interested in, like, how our eyes work together, you know?
Yeah,
Maybe even dealing with some focus challenges yourself.
could be.
Well, you're in the right spot. We took a deep dive into that article you shared, the one about convergence insufficiency, CI for short.
Right.
Ready to unlock the mysteries of CI with us?
Let's do it.
Today's mission: to give you a crash course on exactly what CI is, what causes this vision glitch, how it's diagnosed, and most importantly, what can be done about it.
Sounds like a plan.
Okay, so the article describes CI as like a teamwork problem between your
Awesome.
eyes.
Oh, I like that.
Like, imagine your eyes as a team, right? Working in perfect sync.
Okay.
When you're focused on something close up, like a book or your phone, they're supposed to angle inwards, converge to lock onto that target.
Makes sense.
But with CI, it's like that smooth teamwork kind of goes out the window.
And that's when the trouble starts, right?
Exactly.
The article highlighted some pretty relatable symptoms. Eye strain, headaches, blurred vision, sometimes even double vision. I mean, even if you don't have CI, I bet most of us have felt that kind of uncomfortable strain after staring at a screen for too long.
Oh, for sure.
But here's the thing that really struck me. According to the article, CI is super common, especially with children and young adults.
Really.
Yeah. Makes you wonder, with all the screens in our lives these days, is that connection more than just a coincidence?
Interesting. But before we get ahead of ourselves, let's rewind a bit. What actually causes this eye teamwork breakdown?
So the article points out that while the exact causes of CI aren't totally understood, it's a bit of a medical head scratcher, there are a few usual suspects.
Okay, lay it on me.
One is just weakness in those eye muscles responsible for the inward turning motion.
Right.
Another is potential glitches in the way the brain sends signals to the eyes to coordinate those movements.
Oh, wow. So it's not just the eyes themselves.
Right. It's this whole brain-eye connection we have to consider. Pretty fascinating, right?
Totally.
And get this, even head injuries can play a role.
Oh, wow.
And while we can't, control everything about our biology, the article did mention that certain lifestyle choices can actually increase the risk of developing CI.
Like,
Prolonged computer use, spending too much time playing video games. They even drew a line in the sand at 4 hours. And visually demanding work were all highlighted as potential risk factors.
okay, so for all the gamers out there, myself included, sometimes moderation is key.
Exactly. It's all about balance.
Right. Anything else?
Oh, yeah. There was another point in the article that I found super interesting. The link between CI and other medical conditions like Graves' disease, myasthenia gravis, even Parkinson's and Alzheimer's.
Whoa, that's a pretty serious connection. Could you elaborate on that a bit? What's the link there?
It seems to come down to, the nervous and immune systems. You see, these conditions can mess with the normal function of our nerves and muscles, including the ones that control eye movements, potentially contributing to CI. It really shows you how interconnected our bodies really are, and how seemingly unrelated conditions can have this, ripple effect.
That's incredible. Okay, so we've uncovered some of the mystery behind CI, but let's shift gears to something a little more hopeful.
Sounds good.
Figuring out how we even know if someone has it, and more importantly, what can be done about it. I'm ready for some solutions.
Yeah.
How is CI actually diagnosed and treated?
Well, first of all, diagnosing CI isn't as simple as, checking your vision chart.
Right, right.
The article mentioned a few specific tests that eye doctors use. One is called the close-up check, where they measure how close you can bring an object toward your face before your vision goes double.
It sounds surprisingly straightforward. Like, can you see this one thing or do you see two?
Exactly. It's a pretty clear indicator of how well your eyes are coordinating.
Makes sense.
Then there's the eye cover-up test, which helps determine if the eyes are misaligned and, in which direction.
Okay.
And lastly, they might use prisms during the exam.
No, I've heard of prisms, but how do those actually help diagnose CI?
So imagine them like temporary lenses.
Right.
That can be adjusted to correct double vision. By seeing how much prism correction is needed, eye doctors can kind of get a sense of the severity of the CI. It's all about finding the right level of correction to help the eyes work together more effectively.
So it's a combination of those hands-on tests and I imagine a good conversation with an eye doctor to really get the full picture. Right. What about treatment? What are the options?
Well, the primary treatment the article focused on was vision therapy.
Vision therapy. That sounds intriguing. Tell us more about what that actually involves.
So it's kind of like physical therapy, but for your eyes.
Okay.
Imagine a series of customized exercises specifically designed to strengthen those eye muscles we talked about and improve their coordination. Some of these exercises are done in office with a trained therapist, while others can be done at home.
So it's an active approach, retraining those eyes to work together effectively.
Yeah.
Are there any other options? Anything like a magic pill for CI?
Wouldn't that be nice? While there's no magic pill just yet, the article did mention a few other approaches. Prism glasses, for example, can be helpful. These have special lenses that help shift the image slightly, making it easier for the eyes to converge.
So kind of like a crutch to assist with the convergence.
Exactly. They can be helpful, but are often seen as more of a short-term solution.
Yeah.
Then there are computer programs that use interactive software to, challenge and improve focusing ability.
Okay.
But again, according to the article, these aren't a replacement for in-person vision therapy.
Got it. And what about surgery? Is that ever an option for treating CI?
Yeah, so it's important to note that surgery is typically reserved for very rare and severe cases where other treatment options haven't been successful.
Okay, so it sounds like the key takeaway here is that while CI is definitely treatable, it requires some effort and commitment, sort of like any good training regimen, right? Consistency is key.
You hit the nail on the head. The article really emphasized the importance of patience and persistence with treatment. It really is. Sticking with that treatment plan is super important. But on a brighter note, the article did give some helpful tips for managing CI discomfort and reducing eye strain in general, even outside of formal therapy.
Oh, good. I'm all about those practical tips we can, easily work into our day.
Right.
Absolutely.
Well, one of the simplest yet most often overlooked tips is just blinking more,
Really?
especially during screen time.
It sounds almost too easy. Like when I'm laser focused on a screen, blinking is the last thing on my mind.
It's true, though. It's a natural reflex, but we tend to suppress it when we're concentrating.
Yeah, I guess so.
Those little breaks, even for a fraction of a second, help remoisturize our eyes and prevent dryness and irritation.
Makes sense.
Another tip they mentioned was incorporating some simple eye rolling exercises.
Okay, eye rolling exercises, that sounds kind of funny, but intriguing at the same time.
Right.
How does that help?
So it's all about just relaxing those often overworked eye muscles,
Okay.
looking up, down, side to side. It helps to stretch and relax the muscles surrounding the eye, which can reduce tension and fatigue.
Okay.
They also talked about switching focus between near and far objects regularly.
Right.
So, if you're working on your computer, take a break every now and then to look up and focus on something across the room for a few seconds.
The good old 20-20-20 rule.
Exactly. Every 20 minutes, 20 seconds, looking at something 20 feet away.
Yep.
Simple but effective. And lastly, they recommend using warm compresses to, soothe tired eye
Oh,
muscles.
yeah, like a warm washcloth.
Yeah. A washcloth dipped in warm water, or even those microwavable eye masks can work wonders after a long day of screen time.
Those are all great takeaways, practical, manageable things we can all do. It really highlights how much we overlook those daily habits and how they affect our vision.
It's so true. We often wait until we're experiencing discomfort or problems before even thinking about our eye health.
Right.
But taking a more proactive approach can make a huge difference.
Couldn't agree more. Well, listener, there you have it. A deep dive into the world of convergence insufficiency.
That's right.
We explored the symptoms, causes, and even dove into how it's diagnosed and treated. Plus, we armed you with some simple yet powerful tips to help you take charge of your eye health starting today.
Excellent.
It's been a fascinating journey uncovering these intricacies of how our eyes work together and how important it is to pay attention to even the smallest signs of strain.
It really has.
And, remember, knowledge is power. And now you're equipped with the information you need to prioritize your eye health and to seek help if you need it.
Couldn't have said it better myself.
And who knows, maybe this deep dive will spark a newfound appreciation for that often taken for granted wonder of sight. After all, our eyes really are the windows to our world.